On behalf of the National Health Emergency Committee, I would like to welcome you to the 37th National Situation Report presentation by Dr Mustapha Bittaye, Director of Health Services, who will be presenting the report on behalf of the Chairman of the National Health Emergency Committee, that's the Honorable Minister of Health, Dr. Ahmed Lamin Samate. Dr Bittaye, s'il vous plaît.
Like stated earlier, we are given the 37th National Situation Report since the confirmation of the first case of the novel coronavirus disease in the Gambia on the 17th of March 2020. So 33 new laboratory test results have been received and all tested negative for COVID-19. Of these 33 results, 32 are new tests conducted, and one is the result of a repeat test on the only active case now. 10 new persons, 8 Gambians, 1 Senegalese, and 1 Guinean taken into quarantine on account of traveling into the country from Senegal. Daily follow-up of 99 low-risk contacts still ongoing to ascertain manifestation of symptoms of COVID-19. The country currently has 89 persons under quarantine, 1 active case, and no probable case. A total of 456 tests were conducted and 10 are positive. 297 people completed quarantine, 645 contacts traced, and 310 people completed follow-ups. Globally, since 31st December 2019 and as of 27th of April 2020, a total of 3,059,081 cases of COVID-19 have been reported. Of these, 211,202 deaths were registered, and 919,746 recovered from the disease. For the reports in Senegal, they've recorded now 736 confirmed cases, 284 recoveries, and 9 deaths. On logistics and safety, so there is mandatory temperature checks initiated at the Central Medical Stores, the EOC, main gate as a prerequisite for entry of staff and visitors into the complex. There is a formation of a security task force to support Ministry of Health on COVID-19 response. On surveillance and the laboratory, 10 new persons taken into quarantine and newly discharged patients to be followed up for another 2 weeks. On case management component, so as of now, there's only 1 COVID-19 patient is asymptomatic and currently isolated at the treatment facility. The patient was resampled, another sample was collected, and it tested negative. Another negative sample is required to ascertain recovery status. Psychosocial support regularly given to patients isolated, persons under quarantine, and health workers involved. Safe and dignified burial procedures were observed in the burial of a suspected case in Farafenye, North Bank East. But the results received showed that he was actually negative. The first phase of the Namban Clinic renovation done by TAF Global will be completed soon. On risk communication and community engagement, 7 TV and 3 radio programs successfully conducted, 1 press briefing conducted, 8 communities and 345 households sensitized or engaged on COVID-19 preventive measures using existing community structures. Summary of social media activities, 4 Facebook and 2 Twitter posts shared with a cumulative engagement of 12,300 people reached. Summary of calls made to 1025. A total of 290 calls received, 281 COVID-19 related and 9 non-COVID-19 related. 9 were booked for further follow-up by contact tracing teams and 6 booked for further follow-up by the quarantine team. Regarding our next steps, the Minister of Health will embark on the following: voluntary testing of all patients with respiratory symptoms at all health facilities, engage private pharmacists to report clients presenting with flu-like symptoms to the rapid response teams, sensitization of the public on the existence of burial teams in all health regions, fumigation of homes of newly discharged patients who have recovered from COVID-19, strengthen RRTs and contact tracing teams at all regions, expand isolation centers in all major health facilities and hospitals, deploy newly hired health personnel in their duty stations, enforcement of the letter and spirit of the restriction orders contained in the state of emergency declared, strengthen community surveillance in all regions, especially on designated border areas, continue with daily follow-ups of low-risk contacts and those discharged from quarantine, and encourage public reporting and self-reporting of suspected cases through the toll-free line 1025. Finally, the Minister of Health would like to appeal to communities along the common border between the Gambia and the Republic of Senegal to remain vigilant and report all illegal entries or suspected activities in their areas to their nearest security post or local authorities. We would also like to renew our call on security personnel, especially those within the borderline communities, to carry out regular patrols and closely monitor the movement of people and goods within their jurisdictions. We thank all those who are complementing the efforts of the Gambia government in cash, kind, or any other form in mitigating the direct and indirect impact of COVID-19 on our livelihoods. We would also like to appreciate the efforts of TAF Global Africa for supporting one of the buildings at Namban Clinic. Together we can defeat COVID-19 in the Gambia. Thank you very much.